Hi, everyone. My name is Dr. Ann Auburn, and I'm the founder and owner of the Natural Health Improvement Center in Grandville, Michigan. I'm here tonight to talk to you about vitamin C therapy. Now, the title says vitamin C IV therapy, but I also want you to know a little bit about oral therapy, and I want to talk about low dose and high dose so you know what we use this for in the clinic and what you can use it for at home. So let's get started. What is vitamin C? Well, vitamin C is also known as ascorbic acid. It's a water soluble vitamin. So it's pretty safe. And unlike most mammals and other animals, humans do not have the ability to make their own vitamin C. So you have to get it from your diet. Vitamin C really is an essential cofactor in many enzymatic reactions. Example, when you form collagen or carnitine in your body, neuropeptides, and in the regulation of gene expression. And it's also a potent antioxidant. All right, so let's talk about a few health issues that can be helped with vitamin C. Studies show that higher vitamin C status is associated with lower risk of hypertension, that's high blood pressure, also coronary heart disease, meaning the blockages in the blood vessels around your heart, or what we call atherosclerosis, and stroke. There is some evidence to suggest that vitamin C can be useful in addition to conventional medicine to reduce heart muscle injury and arrhythmias following a cardiac procedure like a stent placement or a pacemaker placement or surgery like a bypass surgery in patients with heart disease. So vitamin C can help you get through that and have less arrhythmias or irregular heart rhythms afterwards. Vitamin C also affects the immune system. Vitamin C has been shown to stimulate both the production and function of white blood cells. White blood cells are kind of the defenders of your immune system. They do a lot to get rid of those foreign invaders that come into the body. White blood cells accumulate vitamin C into high concentrations, which protects them from damage. Vitamin C, as an antioxidant, protects white blood cells from oxidative damage. And regular use of vitamin C shortens the duration of the common colds. When you have vitamin D deficiency, you might have poor wound healing, bleeding gums, hair and tooth loss, easy bruising, or lethargy. Lethargy is extreme fatigue. And this is what sailors saw in scurvy when they were on long journeys sailing across the ocean and didn't have any vitamin C available to them. In fact, some of those uh, sailors and pirates and whatnot, they actually died from lack of vitamin C. So, this results from the loss of vitamin C dependent enzymatic reactions, leading to a lack of collagen, carnitine, and those catecholamines. Those are things like dopamine, norepinephrine, and epinephrine. These are neurotransmitters, and they're released into the body as a response to stress. So you can see how this is maybe later going to tie into adrenals as well. Vitamin C is very important for the adrenal glands. In addition, vitamin C is a cofactor to certain body biochemistry. It regulates the maintenance and expression of human genes. So, we are born with a certain set of genetics, a certain set of genes that, tell the color of our eyes and our hair and things like that. But, there can be some bad genes that might express, lack of ability to detox well or a certain disease state. But how much you express those genetics is actually affected by your vitamin C and your overall health status, which is, a lot of times we check these things when people come into the clinic. We'll do blood tests to see where are your levels of certain vitamins. We can do that with vitamin C, but vitamin C goes in and out of the system so quickly that we don't usually do a vitamin C level, but it can be done. Now, vitamin C and lysine has a particular role with heart and heart attacks. Vitamin C is required to manufacture healthy collagen. This is the glue that holds together the heart artery cells, meaning like the walls of your arteries are made of lots of cells that are stacked together just like bricks. And you can think of collagen as the mortar that holds those together in the walls of your arteries. Then there's lysine. Lysine's an amino acid, and this is like the steel rods in concrete that makes collagen stronger. Now, Linus Pauling looked at this quite extensively, and he claimed that it takes just a mere 10 milligrams per day. That's not very much at all to prevent scurvy. We were talking about those deficiency symptoms earlier. But it takes several thousand milligrams to prevent a heart attack, and therefore to keep your arteries clean. So this researcher, William Stebbins, a professor of anatomy at Wellington University in New Zealand, proved that Pauling was right. Stebbins' research showed that coronary arteries closest to the heart are under the greatest pressure, and this causes collagen to fracture, resulting in the formation of a blood clot and death. So what we're saying here is it's not all just cholesterol, it's actually the health of your artery walls. So, Dr. Sidney Bush, an English researcher, has now proven that vitamin C can reverse atherosclerosis. Bush took retinal photographs, that's photographs of the back of the eye, and then started his patients on high doses of vitamin C and lysine. 1 year later, additional pictures showed that the atherosclerosis, or the blockages in the arteries in the back of the eye, had regressed in those retinal arteries. This also occurs in coronary and other arteries. So coronary means heart arteries. Those are what we're most concerned about because we need that pump to pump around the blood. And Linus Pauling recommended doses of 3 to 18 grams of ascorbic acid and 3 to 6 grams of lysine. Now, most people aren't going to be able to tolerate much above 2 to 3,000 milligrams or 2 to 3 grams orally per day, but you can get in higher doses if you do liposomal vitamin C, which we'll talk about a little bit later. Since that time, the Pauling protocol has been updated by Pauling and Rath. Dr. Rath was an associate of Dr. Pauling's. And there's an article that I found on this. The full article is at the link below. I'll let you snap a picture of that on your phone. So if you want to go to it, I just looked up vitamin C and heart disease or preventing heart attacks or something like that, and I found the article. Basically, the updated protocol includes vitamin C, 3 to 18 grams per day, lysine, 2 to 6 grams per day, coenzyme Q10, 100 to 300 milligrams per day, and proline, the last addition to that protocol, 250 to 2,000 milligrams per day. Now, I probably wouldn't do these really high doses unless I knew that a person had the beginnings of vascular disease. Sometimes at our clinic, we'll do a study called a calcium scoring CT scan. It's a very, very fast and low dose radiation CT scan. And they're taking pictures of the heart in sort of layers. And it shows if there's any calcium buildup in your coronary arteries. And the vast majority of cases of people with coronary artery disease or atherosclerosis will have this calcium collection in the artery walls. And it will give a reading of each of the heart vessels and how much calcium is then in there, and therefore a prediction of how much atherosclerosis you have. The calcium scoring CT scan doesn't tell us how stable those blockages are or how big they are, but it gives us a general idea. If it's pretty high, I do send people to a cardiologist to have an echo stress test or some kind of other testing to see how bad it actually is. And then we usually recommend IV chelation and other things, and we might put them on this protocol with the vitamin C, lysine, CoQ10, and proline to see if we can help reverse some of that atherosclerosis along with our IV EDTA chelation. And I have a whole nother talk about IV EDTA chelation. It's part of my heavy metal detoxification lecture. And I have that on Facebook and on YouTube. So if you ever want to look that up and learn more about it. So, also on this updated Rath and Pauling protocol, there are other websites that are connected with that, people that are keeping this information out there for people. You can see the links below. You might want to snap a picture of this as well if you're interested. The vitamincfoundation.org, thecureforheartdisease.com, paulingtherapy.com, and hearttechnology.com. All right, so animals and vitamin C, like I said earlier, most animals except for fish and primates, like humans and guinea pigs, can make their own vitamin C. Interestingly, animals that do make their own vitamin C still experience a drop in vitamin C levels when they're sick or stressed. So this is, an example of how, when there's a stress on the body, when you are sick or you have some kind of life stressors that are really big, you will drop your vitamin C levels, and we don't make any. So we have to take that vitamin C on a regular basis to keep us healthy. And, that's why I do encourage most of my patients to take, or basically all of my patients, to take a multivitamin, multimineral, because in the good ones, there's always a fair amount of vitamin C in it, along with other antioxidants, your good B vitamins, your good minerals, and usually there's a little detox blend in there as well. So if you're wondering if you're taking a good multivitamin, you can always come to the clinic and bring your bottles so we can read the back of them and actually know what's in it. I also recommend to people never take a vitamin that has dyes in it or weird fillers that you can't pronounce or something like that. Those are usually junk vitamins. Also, if your vitamins have calcium carbonate or if they have magnesium oxide, they probably are not very good. Also, your vitamins B12 and folic acid, those should be methylated. Every multivitamin that has those two B vitamins in it, B12 and folic acid, if it doesn't say methylated, then it's not the best form for helping your body, and it's not that usable by the body. So, on with this animals and vitamin C point here. Linus Pauling noted that animals that make their own vitamin C do not get heart attacks or atherosclerosis. So that really kind of shows how important that it is. And since we don't make it, we have to somehow get it in our bodies. And if we know we're stressed a lot, or we know that we've recently been sick, I recently had a little, upper respiratory infection, and I did some vitamin C IVs, and I did some Myers cocktails. I'll talk to you about that later, so you know what that is. But that was part of my healing process. You know, just like everybody else, I can catch a virus or bacteria if it comes along, and just gets in my system. But luckily, I have the tools to recover from it, and I usually recover pretty fast. And thank goodness for the tools I have because I'm a very busy person. All right, so I just wanted to put some books up here so that you know that there are lots of books out there that discuss vitamin C, IV, and oral, and and how it's used in many medical conditions. I particularly love Dr. Tom Levy's books, Curing the Incurable, Vitamin C, Infectious Diseases and Toxins, and Primal Panacea. Those are some of my favorite books because he really went back into the history, and he reviews all these cases and tells you details of how it works, and they're just very, very excellent and entertaining books. And Dr. Levy is a cardiologist, and he's also an attorney. So he really gets down to the nitty gritty and tells you the details and tells some amazing stories. I believe it's in his book Primal Panacea, where he talks about a case of a New Zealand man who got I think it was the H1N1 virus. He was very, very sick. He was in a coma for weeks. The hospital had basically given up on him and asked the family if they wanted to unplug him from the ventilator because he was on a ventilator. And then one of his children heard about Dr. Levy's books and about vitamin C and vitamin C intravenously and how much more powerful it was than oral. And they somehow convinced the hospital to start doing vitamin C. Well, they only started with about 2.5 milligram or grams, which is not that much. And then they advanced him slowly up until they were giving him somewhere between 25 and 50 grams per day, I think it was. I can't remember the details, but they were giving him a hefty amount. And lo and behold, he woke up out of his coma. And then he was sent to rehab because he had been he had been deconditioned from being in bed so long. And when they sent him to rehab, they stopped the vitamin C IVs, and he kind of deteriorated a little bit. He didn't go back into a coma, but he just did not feel as well as when he was getting the vitamin C. And so his family had to go through all the channels again to get the new doctors at the rehabilitation facility to give him vitamin C again. And as they slowly increased his dose again from a small dose to a much higher dose, he just got better and better and better because he was repairing his body with it. That's why we use vitamin C and vitamin C containing IVs so often before and after surgery, or before and after illness, or during illness. And this man made a full recovery. It's actually covered in a 60 Minutes episode from New Zealand. It might still be available on the internet. You might be able to find it, but the story is incredible. The guy had no side effects whatsoever after being in a coma for weeks. And he went back to, I guess he owned a huge cattle farm there in New Zealand, and he went back to work and was totally normal, no side effects. And that is a miraculous story that everybody should know about. Now, these books are books that discuss vitamin C, both IV and oral, in cancer care. And we do some cancer immune support care at our clinic. We are not oncologists. We do not treat cancer per se. We are treating the immune system, and we're letting the oncologists do their work and the patients do what they feel is necessary with their oncologist. I think the best treatment for cancer is a combination of traditional care that really is needed and uh, supportive functional medicine, integrative medicine care that we do at our office. Those two things work so well together, and they really can be miraculous. My own brother is a survivor of many years now of metastatic bladder cancer. In my heart, I know that the oncologist did help him, but their therapies after about somewhere between 6 months and a year and a half were not workable anymore. They were too hard on his body, and during that time, we introduced all of some of the things I'm talking about here today: IV vitamin C, IV ozone, mistletoe injections, lots of supplements that were anti-cancer and immune supporting and helpful for down regulating the genes that cancer uses to survive. And, his oncologist thinks he's a miracle today. We can't take on that many cancer patients for these therapies because we do family practice and other functional medicine as well. We're a very busy clinic, but we're very proud of the work that we do, and we're very happy to help people in this way. So, what is low dose vitamin C? Low dose vitamin C, basically in the intravenous form, is considered 10 grams or less. It's considered low dose because you're not going to get as high of blood levels when you do this, and it's not going to have its long term effects, for 24 to 48 hours as much as doing like a 25 gram or 50 gram vitamin C IV. Now, oral vitamin C, even at higher doses, like up to 36 grams of a form of vitamin C that's taken orally called liposomal vitamin C, which means lipid loving, which means your cell membranes that are made of fat absorb it much better. And it, even with this much more absorbable form called liposomal vitamin C, it just does not raise your blood levels as much as IV vitamin C does. So it's really low dose vitamin C. So IVC is always going to be better if you're in a acute situation, if you have a severe illness, if you're recovering from a severe illness, or if you are, battling cancer. We always suggest IV vitamin C. There's some very good papers on that. Um, but even so, there are still benefits of low dose oral vitamin C, and some of those are the ones that we discussed earlier. And I remember talking to Dr. Levy one time, and he said any vitamin C, any form, as much as they can get in regularly, and it's going to help them. But when we're in a more critical situation, we want to do more IV vitamin C. Now, the basis for IV nutrient therapy is that nutrients given through an IV or intravenously in a blood vessel in your arm, they can reach much, much higher levels in your blood than those taken by mouth. Vitamin C taken by mouth is limited because your digestive system can only absorb so much at a time, and your body will quickly get rid of the excess through your kidneys. So only the IV vitamin C can reach high enough levels in the blood to help really fight serious infections, get rid of heavy toxins, help kill some of those tumor cells and cancer, and detox heavy metals and relax muscles and repair to a great degree. So the higher dose IVC is for more serious things or more heavily needed recovery. So when is IVC or IV nutrition the treatment of choice? Well, here's a list of some examples: acute illness, chronic illness like Lyme or other viral infections that just won't seem to go away. Epstein-Barr virus, if it's causing chronic fatigue, can be one that we treat with a high-dose IV vitamin C, or some of our other IVs containing IVC. Fatigue, like chronic fatigue, or even acute fatigue, brain fog, asthma, allergic reactions, seasonal allergies, chronic hives, itching, difficulty healing, pre and post surgery, if you want to get improved athletic performance, severe emotional distress, depression. Although there's other IVs I might give for that as well. Something with some B vitamins might help the nervous system to kind of recover and improve. Also, if we know a person has immune deficiency, muscle pain or spasms, if a person's recovering from like a broken bone or injury, a sprain, something like that. Also, migraine headaches can be helped, although I do love the Myers cocktail with double magnesium for migraine headaches. That's also helpful. Also, detox support. We do a lot of heavy metal detox at our office, but as you'll learn about with Dr. Klenner, he did some crazy things with snake bites and things like that back in the 30s and 40s. And also, narcotic withdrawal can really be helped by IV vitamin C. All right, so regarding IV vitamin C, there's over 1,200 medical and scientific journal articles that have been written on this amazing vitamin, and that's just over the last century. And there's one new article every day that's coming out on ascorbic acid. So it's a heavily, heavily studied subject, and it continues to be one of the most researched substances in the history of medical research. Again, this is Dr. Thomas Levy's book, Vitamin C, Infectious Diseases and Toxins, Curing the Incurable. The book reviews how IV vitamin C has been able to cure many incurable viral infections and other infectious diseases, as well as being the treatment of choice for many potentially fatal toxins that have no other form of effective treatment. And IV vitamin C has virtually no side effects. You just have to have, decent veins in order to run it. But if we have to run it slower, we can do that as well, even if your veins aren't that great. The other reason I want to bring this up is, there is an excessive use of antibiotics in our country, and it is producing antibiotic resistance. So now, we're getting superbugs and, people that have to take these medicines all the time, they're not working as well. Um, I have some patients in my clinic that have chronic diseases that require antibiotics on a regular basis. And those people, if they do IV vitamin C or IV Myers cocktails or IV Felice IVs, which is amino acid IVs with some vitamin C and other nutrients, they actually do much better. In fact, I have a patient who showed me some papers showing that even our EDTA chelation, it magnifies the benefit of antibiotics about 1,000 times. So, there's many natural things we do at our clinic that can help you through and to some degree prevent some of this antibiotic resistance. Just to give you an idea on this antibiotic resistance, according to the CDC, about 1.7 million infections happen in hospitals each year, and these infections lead to or are linked to 99,000 deaths. You've probably all heard of MRSA, the methicillin-resistant Staphylococcus aureus. It's a type of bacteria that causes skin infections, and it's just one of the most serious infections in hospitals and can be brought home, spreading to others, and it's just really hard to get rid of. Another one is Acinetobacter baumannii. It's a bacteria that can cause severe pneumonia, urinary tract infections, and bloodstream infections. And there's others like these, but it's important not to overuse antibiotics because it can make bacteria stronger and harder to kill in the future. Yes, antibiotics are needed. Like when somebody has a strep infection, I give them antibiotics because I don't want that strep to damage their nervous system or their kidneys or cause vegetations on their heart valves and cause problems later with their heart. So there are appropriate uses of antibiotics, but we just don't want to use them for every little virus that comes along. We want to let the body work through that, and we can help it with vitamin C and other nutrients that we have at our functional medicine clinic to help the body's immune system. Now, I want to tell you a little bit about Dr. Klenner because he was really the pioneer in IV vitamin C. Dr. Frederick Klenner graduated from Duke University School of Medicine in, believe it or not, 1936. So in 1936, he was looking at using IV vitamin C. His subspecialty was diseases of the chest, and he became interested in using massive doses of vitamin C for viral diseases and other illnesses, and one of those is polio. We'll talk about that later. He inspired Linus Pauling and Irwin Stone to expand the research on the great benefits of intravenous vitamin C. In 1948, he published his first paper on large doses of vitamin C in the treatment of viral diseases, and he believed anyone who is ill, this is his quote here, should get large doses of vitamin C in all pathological conditions while the physician ponders the diagnosis. Mainstream physicians and state medical boards at the time were saying, large doses of vitamin C before diagnosis is sheer quackery. Treatment of illness should follow diagnosis. Well, in his day and age, there wasn't a lot available, and, people were dying of polio and things like that. And he ended up being 100% correct about giving them vitamin C. If you want to know more about this, you can see Dr. Klenner's paper. It's on the internet. All you have to do is look up Dr. Frederick Klenner and clinical guide to the use of vitamin C, and he has so much interesting information in there. Very eye-opening. Klenner summarized what vitamin C does in polio. It does virus destruction. It dehydrates the brain and spinal cord safely. When you get polio, there's a lot of inflammation in the nervous system, and that's what causes a lot of the nervous system damage. And, you've probably seen some people that had polio and they can't use their legs correctly. Some of the nerves are damaged from it. And it supports and normalizes the stressed adrenal glands, and it preserves the lining of the central canal. So he's talking about the spinal column. And it maintains a more regular spacing and less crowding of the ependymal cells. That's the surface cells of the spinal cord. So this is how he felt it worked in polio. And he cured many cases of polio by using high-dose IV vitamin C. And let's look at how vitamin C works in cells with viral infections. Well, vitamin C enters all your cells. Once inside, it blocks the virus from making new parts that need to spread. So infected cells may burst and die, but the virus can't spread because the other two other cells, because no new virus particles are made. The vitamin C stopped that inside the cell. So if a virus does get into a cell, vitamin C helps break down the certain components that the viruses need to keep growing. So vitamin C might help by removing a protective layer around viruses in the blood or cells. This could allow the body's immune system, especially white blood cells and antibodies, to attack and neutralize the virus. According to Dr. Klenner, vitamin C also combines with viral proteins to form a new substance that may stop the virus from multiplying. So this is the other really interesting thing is vitamin C creates hydrogen peroxide in your cells. And it's another interesting fact, I don't have it on the slide here, but when your white blood cells are attacking an infection, one of the things they do at that infection site at that cell is they create hydrogen peroxide. It's one of the ways that your body uses all of its defenses to damage a foreign invader. Vitamin C helps create hydrogen peroxide. And, you probably think of the hydrogen peroxide you buy in the brown bottle at the drugstore. But this substance, it's harmful and can break down cells. In a process called the Fenton reaction, iron in the cells reacts with hydrogen peroxide, creating highly reactive particles called free radicals, and that can damage nearby harmful cells. Now let's talk about why vitamin C creating hydrogen peroxide doesn't damage healthy cells, but it damages disease cells. Inside a disease cell, like one that's infected by a virus, bacteria, or a cancer cell, the cell's inner parts are damaged and they just don't work right. These cells don't have enough of the enzyme catalase, an antioxidant enzyme, which usually helps get rid of harmful substances like hydrogen peroxide, making them more vulnerable. So these disease cells are vulnerable to the hydrogen peroxide that's produced at the cell when this high dose vitamin C gets there. But in healthy cells, they have more of these protective enzymes and they stay safe from the damage. So that's the difference. And a similar thing that happens with ozone. We also do ozone or O3 intravenously at our clinic. What happens, I have a whole lecture on that too. So if you want to watch my lecture about ozone, we take about 50 or 60 cc's of blood out of the person. We put it in a bag with saline. We have a blood thinner in there, just a mild one that makes it so it doesn't clot. And then we add the ozone to the bag. It mixes with the red blood cells, and then that is all given back to the person. And the ozone does not damage normal cells because of the normal cell's antioxidant enzyme network. In fact, ozone helps your body make more antioxidant enzymes so that it has more defenses to toxins and things like that. But the vulnerable diseased cells or infected cells or cancer cells, they are destroyed, broken down when ozone goes in there. So ozone and vitamin C are very similar in how they work. Ozone just does some other additional things, and you can listen to my lecture on that if you want to learn about it. So yeah, consider ozone treatments if you want to make more antioxidant enzymes. And I explained that whole effect there. But when we have a cancer patient, what we normally do is we rotate IV vitamin C 1 month and then IV ozone the next month. And then if they really can't afford to come in for the IV ozone will do rectal ozone at home. They do it themselves. We have a setup for that so they can do it at home. It's kind of the next best thing to IV ozone. Um, IV ozone is also very antiviral. It's great for things like shingles and other viral infections. Other benefits of ozone is that it helps you make more ATP. That's the energy source for your cells. So it basically is increasing mitochondrial function and making your cells work better. Also, it makes your cells just use oxygen better. Every cell in the body gets more oxygen actually utilized at the cell. So there's a whole list of effects of ozone. If you would like a copy of that handout, you can call my clinic and ask for the handout that goes over the 13 proven effects of ozone in the human body. In the book, The Metabolic Approach to Cancer, it lists vitamin C immune and anti-cancer actions. It's antiviral, antibacterial. It increases levels of interferon. That's a signaling protein produced in response to tumor development. It selectively increases the poisoning of cancer cells. It reduces the carcinogenic effect of toxins on DNA, the thing that helps your cells function and work right. It increases natural killer cell activity. Those are very important white blood cells in your body that you use for infections and for helping your immune system be ready for any invaders. It increases antibody responses. Let's see, it's required for the creation of immunoglobulins, and it's anti-angiogenic, meaning it kind of blocks the formation of new blood vessels that cancer wants to make for its own survival. It's anti-inflammatory, and at lower doses works as a powerful antioxidant. So vitamin C and toxins, this is a very interesting piece of information from some of the early researchers. Vitamin C in vitro at body temperature inactivates certain toxins at a very alarming rate. Back in 1938, some researchers, a guy named Klegler, placed vitamin C in test tubes with toxins, and after incubation for 48 hours, the toxins were the toxins were not lethal in mice when injected. Whereas if they didn't, it just injected the toxin, it would have killed the mice. But after it was incubated in the tube with the vitamin C, it was no longer toxic. So the more toxin in the tube, the faster the vitamin C disappeared. And I guess the opposite of that, their quote from their study was, the rate of disappearance of the vitamin C in toxin and ordinary broth was more striking the greater the concentration of vitamin C. So Dr. Klenner concluded from this that the degree of neutralization in a virus infection will be in proportion to the concentration of vitamin C and the length of time that it's there. So more mechanisms of vitamin C. It helps your body breathe at the cellular level by supporting energy production. It plays a key role in helping your liver remove harmful substances like toxins, viruses, bacteria from the blood. When you have a fever or are dealing with toxins or bacteria, your vitamin C levels can drop, as we mentioned earlier. That also happens in even animals that make their own vitamin C. Dr. Klenner believes that if you keep your vitamin C levels high, your body can recover more quickly, despite the fever and infection. That's one reason why I recommend that people take their multivitamin twice per day, because that vitamin C is only going to stay in the blood about 12 hours, and then it's going to be gone. So any vitamin C you have in your multivitamin, or if you're taking extra vitamin C, and normally if you're already taking a multivitamin, I would say probably another 500 milligrams twice a day is a good dose. You take it twice a day, then it's kind of always going to be in your system. And he suggests that vitamin C helps your body fight off invaders by boosting your overall resistance. So more mechanisms of vitamin C. When tissues in your body don't get enough oxygen, vitamin C can help improve this by reducing acidity and lowering stress hormones like adrenaline. This allows your blood vessels to relax and organs like the liver and pancreas to get the nutrients they need to work properly. Taking the right amount of vitamin C regularly can help your body return to normal function and improve overall health. Now, vitamin C in the adrenals is interesting. The adrenal glands contain a very high amount of vitamin C. It's said that they contain more vitamin C than any organ in the body. During an infection, vitamin C is absent from the urine and is decreased or absent in blood. Vitamin C in the adrenal glands was greatly reduced in animals succumbing to polio. Dr. Klenner talks about a 1934-1935 study. Hans Seeley knew the adrenals show damage with stress. He saw that all patients ill with the virus would show small leaks of blood into the skin. They call these petechiae. And those had to be pretty sick people. That was when a tourniquet was applied to their arm for some reason, maybe they were drawing blood or something like that, they would notice these petechiae or leaks of blood from the tiny blood vessels in your skin. Also, sugar in the urine associated with the leaky blood disappeared when adequate serum levels of vitamin C were obtained. So these were some of the very early 1930s pieces of information about vitamin C. So they knew it was doing something very special and it was helping their patients. All right, so vitamin C and collagen, connective tissue, and the capillary walls. I kind of alluded to this earlier. It's known that vitamin C regulates the fibrous tissue substance of the capillary artery walls. Remember the bricks and the mortar that I talked about earlier? Okay, so the collagen of all fibrous tissue structures is dependent on an adequate level of vitamin C. So fibrous tissue is hair, skin, nails, discs in your back, ligaments, tendons, fascia, all of that. So you can see vitamin C is very important in the human body. When you have increased capillary fragility, this is observed in individuals when the blood level of vitamin C drops to 1 milligram per liter. These weak capillary walls may allow a simple virus to invade the brain. And this may remind you of a nasty virus we've seen over the last few years that was really a problem back in 2020 and 2021. So again, vitamin C, helps viral situations. It helps make that blood-brain barrier stronger. People may have done better if they had a better vitamin C status when that nasty virus came along. Again, vitamin C and collagen, connective tissue. Dr. Klenner quotes the studies that show that when vitamin C is given intravenously to patients with a deficiency, fibroblasts, those are some of the cells that start to form connective tissue, and capillary bloods form within just a few hours. I'm not sure, he must have been looking at them under a microscope or something like that, but he was quite an amazing person to find these things back in the 30s and 40s. In a similar time frame, when used as an antibiotic, that's vitamin C being used as an antibiotic, fever falls and white count climbs. So those things were observed while vitamin C was helping people. Now, vitamin C works in the body when taken by mouth or through an IV, but it is more potent in an IV. And this was kind of outlined by Mark Levine's group in 1996. They highlighted the dramatic differences between the pharmacokinetics, or how blood levels rise and fall when you take an oral dose or an IV dose of vitamin C. They noted that intestinal uptake of oral vitamin C is regulated by the sodium-dependent vitamin C transporter number 1, SVCT1, which is bypassed when you do IV vitamin C administration. So that was the reason they found out that when you take it orally, it just doesn't work as well. It's you just can only take up so much of it because of this transporter molecule, and then the rest you just basically pee out through your kidneys. So oral versus IVC, Levine's NIH study showed the inability of the gut to achieve serum levels greater than about 200 micromoles while IV goes much, much higher. This proved that the discrepancies between the original Cameron and Pauling IV studies and the Mayo Clinic oral C studies were due to the increased efficacy of vitamin C. What I'm saying there is basically back in the day when Pauling and Cameron were doing all their work with IV vitamin C and seeing these miraculous things happen, Mayo Clinic did a study and they said, oh, well, they disproved, that vitamin C does anything. And what happened was the vitamin C studies with Mayo Clinic were done with oral vitamin C. And the Linus Pauling and Dr. Cameron studies were done with IVC. And that's why there was such a huge discrepancy. But they didn't know that at the time. And Mayo Clinic just said, oh, vitamin C, that doesn't work. But it was because they were doing it orally. So big, big, big difference. But when Levine did his research and showed the differences and figured out why that was, this sparked just a huge surge of new research in the field of vitamin C over the last 20 years, which is very wonderful. Now, factors that would determine your vitamin C need have to do with a lot of things: your age, your habits like diet, alcohol use, drug use, medication use, tobacco, sleep, especially if you use medications to sleep, trauma of infection, of physical injury, of work, of emotions, of surgery, your kidney threshold, how healthy are your kidneys, the environment, physiological stress, climate changes, loss of vitamin C in stools, especially if you have like a inflammatory bowel disease and you have diarrhea a lot or something like that. Just your absorption ability, your gut absorption ability, binders and tablets, if you're taking a tablet form, individual difference in body chemistry, and also the other toxins that are in our environment, drugs, pesticides, carbon monoxide, things like that, other things we're exposed to, a person's weight, or poor storage ability and usability of that vitamin C. So these things are all taken into consideration. We make some very general recommendations, but we are kind of thinking about these things in the back of our minds when we're deciding what to do with a patient. The amount of vitamin C needed, according to Dr. Klenner, depends on how serious the illness is and how well the person's immune system is working. So the worse the illness is and the worse their immune system is off to start with, the more vitamin C they need. And he said typically a dose of 65 milligrams of vitamin C per kilogram of body weight given every 2 to 4 hours by injection can help with most serious infections. For more serious conditions, larger doses given as a single injection might be more effective. So what does 65 milligrams per kilogram every 2 to 4 hours look like? Well, if somebody's seriously sick, I recommend taking 25 grams of IV vitamin C. They don't have to do it every single day. They can be doing some oral liposomal vitamin C at home but usually it's somewhere between 2 to 3 days a week that we're having them do this, or ozone IVs. And then even at home, we know vitamin C only stays in the system about 12 hours. There are some chain reactions of things that are happening that are good for the immune system for 24 to 48 hours after that vitamin C is out of the system. But we do recommend that 2 to 4,000 milligrams of liposomal C before bed each day until you feel better, and then do it for 2 more days after that can be extremely helpful for an illness. If you can't get the IV vitamin C, take 3 to 4,000 milligrams of liposomal vitamin C. Liposomal vitamin C, the form that's lipid loving, that's absorbed better into the cell. Basically they kind of give sort of a generalization that your liposomal vitamin C is 3 to 5 times as strong as your regular vitamin C. Regular vitamin C is great too, but you're going to run into bowel tolerance after about 2 or 3,000 milligrams. You could get diarrhea, or you could get a lot of gas and bloating. So we always recommend, if you're trying to go for higher doses, liposomal vitamin C. And if you can't do the IVs, if you do 3 to 4,000 milligrams every 3 to 4 hours, that's going to be kind of like taking 12,000, maybe 15,000 every 3 to 4 hours. And again, you're going to lose some of that because it's going through the digestive tract, but you're going to get more of it because it's liposomal vitamin C. And you can use brands like Live On Labs, New Medica, or Sovereign Labs. We have all of those at our office. About the liposomal vitamin C, a 2008 study showed that taking large doses, 36 grams of liposomal vitamin C, only raised the vitamin C levels in the blood to 400 micromoles. And another study using vitamin C by IV raised the blood levels to 49,000 micromoles. That's about 122 times higher than liposomal vitamin C. So I don't want you to think after my talk that, oh, I can just do liposomal vitamin C and that'll be fine. If you're seriously sick, if you've got a bad bronchitis or pneumonia or, chronic Lyme disease or something like that, you're going to be way better off if you take IV vitamin C. But, if IV is not an option, oral liposomal vitamin C will work better than oral regular vitamin C. All right, and then you might hear people talk about the vitamin C flush if you want to try and figure out, okay, what's my daily dose that I should be taking all the time? There's a couple of ways to do this. You can do it with buffered vitamin C. This is less likely to cause gas and diarrhea, but it's still regular vitamin C, so there is going to be a limit on it. But you could do it with liposomal vitamin C, but the doses are going to be much higher. And they may never really produce a flush. So this is really designed to be done with the buffered vitamin C. You start with 1,000 milligrams orally and then increase by 500 or 1,000 milligrams daily until you get slightly loose stools, and then you back. That's what we call the loose stools, are called the vitamin C flush. And then you reduce that dose just slightly by maybe like 500 milligrams or so to find your ideal daily dose. There's another version of this that increases the vitamin C intake every 2 hours. So you do it all in one day. So if you're going to do that one and do it every 2 hours at home, you better stay home because at some point your stools are probably going to get loose. Higher dosing by Klenner, he talks about treating a black widow spider bite. I know he also, in some of the things I read about him, he talked about like snake bites that there's no anti-venom for, things like that. That dosing would be 350 milligrams per kilogram. Remember before I was saying 65 milligrams per kilogram every 2 to 4 hours as an injection. And an example of this high dosing would be, let's take a 128-pound woman, that would be 58 kilograms. 350 milligrams times 58 kilograms is 20,300 milligrams. So that's about 20 grams. So, that's close to our 25 gram IV vitamin C. That's really the lowest IVC we do, unless we're doing a Myers cocktail or a Gabby IV push or a Felice IV. That's pretty much the lowest IV vitamin C that we do. We typically do this, and it's easy to administer. If you want to learn more about the Myers cocktail that I just mentioned, there's a great article. You can find this on the internet. We also have a copy at our office. It's Dr. Alan Gabby's monograph, and he basically inherited Dr. Myers' patients. And when he did, he kept hearing about this Myers cocktail. And so looking back through all the patient charts, he figured out what it was, and it's a combination of vitamin C and magnesium and calcium and B vitamins. And, these people just raved about it. And he did, write a paper of all these people's responses, things like asthma, colds, allergies, emotional upsets, things like that were all improved by the Myers cocktail. And I have used it in that way many times. And people unexpectedly have somebody in their family die and they're very, very upset. we'll just have them come in 2-3 times a week and get a Myers, and they do feel better. It calms them down. It helps those adrenals to, recover from the shock. So yeah, this is a great read if you ever get a chance. It's written for the layperson. It's very understandable. Great article. And this is basically what's in a Myers cocktail IV. We run it over about 45 to 60 minutes. It's very easy to do. It's sterile water, vitamin C, magnesium, calcium, B5, B6, B12, trace minerals, B complex, and then a little bit of bicarb to buffer the solution. And then we have a version of this, which is a smaller amount of everything. It's called the Gabby IV Push. Actually, the long version is the Gabby Wright IV Push because Dr. Alan Gabby and Dr. Jonathan Wright put it together. It's just kind of like a mini Myers cocktail. You run this over 10 to 20 minutes. We used to push it, that's why we call it IV push, but now we put it in a little tiny IV bag, and the girls can let it drip so they can do something else while it's dripping in over 10 to 20 minutes. But it's basically the same things in it: bacteriostatic water, the calcium gluconate, vitamin C, magnesium, and then the other B vitamins, as I mentioned before. And use this for the Gabby IV Push and Myers cocktail. This list will look kind of similar to the other list for the high dose vitamin C. Again, these are always an option depending on how serious your illness is, but recovery from illness, like my recent respiratory infection I had, asthma, allergies, fatigue, migraine headaches, and a lot of times with those we double the magnesium, muscle pain, difficulty sleeping, insomnia, things like that, chronic fatigue syndrome, depression, withdrawal from medications and narcotics. If you want improved athletic performance, it's just great for your body. You could consider it for somebody who's hyperthyroid, but hyperthyroidism can kind of be an urgent situation, so we don't want to make you think that Myers cocktails or Gabby IV pushes are a treatment. I mean, if you truly have hyperthyroidism, you need probably medication and other studies done to find out why you have it and handle the root cause. And then side effects from cancer treatments. We use this in the vitamin C IVs a lot to help with tissue healing, repair, recovery, improving energy, even after a lot of our patients had that terrible virus that came through the country a few years ago and has kind of stuck with us a little bit. Those patients really benefited from doing a Myers cocktail, and a lot of my patients just continued doing them monthly or quarterly because they felt so good with them. And side effects of IVC, really not much. It's very, very, very safe. Over many decades of high dose IV vitamin C, there's very few side effects that have been reported. There's a study by Yadi et al., 2010, and then 9,300 some patients were surveyed, and only 1% reported minor side effects like lethargy, fatigue, change in mental status. That's very unusual. Usually the change in mental status is improved, and vein irritation. That's always a possibility when you're putting something in IV. And then a more recent phase 1 safety trial just found only minor side effects, no adverse events over and above what would have been expected from underlying disease or chemotherapy or anything like that. And there's those studies listed there as well. So safety of IV vitamin C and oxalate stones. I get this a lot from patients that have had kidney stones, like, oh, no, I can't do any vitamin C. But really the problem is more with people who have bad kidney function and have had renal calculi or kidney stones. There's really there was just one patient with a history of renal calculi who developed kidney stone following 2 weeks of continuous IVC. That was at the Reardon Clinic that's done some of the studies on cancer and vitamin C. And then acute oxalate nephropathy, meaning oxalates damaging the kidneys, in several cases have also been reported, but these were all in patients who had existing kidney dysfunction. So it's actually pretty safe, and a person, of course, could try vitamin C intravenously and do okay. High dose IVC may be contraindicated for patients with renal dysfunction due to poor kidney clearance. In individuals with normal renal function, IVC of up to 1.5 kilograms per kilogram resulted in less than 0.5% conversion into oxalic acid. So that's a very small amount of oxalates. So most of those people probably could do the high dose vitamin C IVs and not have any problems. IVC is very safe with kidney function. Now, the Felice IV, I mentioned this earlier when I was talking, the Felice amino acid IV. It's just one of the IVs we have that has vitamin C in it, along with amino acids, which is its main ingredient, magnesium, potassium, B6, copper, selenium, zinc, manganese, chromium, molybdenum, calcium gluconate, and vitamin A and B complex. And this is a fantastic IV. I do use it a lot before and after surgery. I use it for people that are really tired, people that are detoxing a lot, people coming off of alcohol, people coming off of psychiatric medications or opiates or whatever. It really, really does help them feel very much more robust. And I'm sure it's the amino acids, but it also has some vitamin C in it and these other minerals that are reparative and restoring. So uses for that Felice amino acid IV would be severe fatigue, chronic fatigue, adrenal fatigue, pre and post surgery, broken bones, difficulty with healing, and adjunct to cancer and radiation treatments to help healing and to counteract the negative effects and preserve, repair healthy tissues. And that's all I have for you tonight. I thank you for listening, and I hope you got something great out of this. I hope you learned something and got some new references to look at. If you do have any comments or questions, please leave them and we'll answer them within 1 to 2 business days. This is pre-recorded. And so if you want a PDF of the presentation with any other information that we have on this lecture, I'm not sure we have a lot of that for this lecture, but whatever we have, we'd be glad to give you a copy. And this will be available on our Facebook page forever and on YouTube. So if you ever want to go back and watch it, I hope you enjoyed the presentation, and I hope if you ever need anything like IV vitamin C, do consider coming to the Natural Health Improvement Center, where we love to help restore health with a holistic approach. Take care and good night. Stay well, everyone. Bye-bye.